Well, thank you, and thank you all for being here today to talk about this very important issue of veteran suicide. And I associate myself with my colleagues' comments that we all focus and want to provide as much help, assistance to the VA to accomplish your mission as possible in this area. One of the things that came to my attention in the testimony that you provided ahead of today's hearing is that 99 out of 140 VHA facility directors reported that they had at least one severe shortage area in mental health care providers. So I wanted to know how that affected our community. I reached out to the director and the staff at the Hampton VA in Virginia, and I found out that the vacancy rate at the Hampton VA for mental health care providers is 35.5%, whereas the VHA rate in mental health across the country is 10% roughly. And in certain areas, there's 0 providers, so 100% vacancy in that specific field or type of provider. So that made me think, are staffing shortages the reason that you're not meeting benchmarks, that you feel that you're not necessarily able to provide the care and the time to the number of people who might need the care? Just basically, what impact is this having on our ability to go after this problem?
Thank you for that question. Definitely the issue of trying to recruit the appropriate staff to staff all our mental health units across the country continues to be a challenge. As Dr. Carroll mentioned, we've made some tremendous progress in the last few years. However, there are pockets, and you are mentioning one of those, where we still have difficulty trying to bring the staff on to the level that we need to support the demand, because you have a very high growing area where we have a lot of veterans who are seeking care. So it is something that we're working on. Dr. Carroll, you may have some additional information about that specific site.
Well, and also as you continue to address this in your response, what can we do about the hiring? I understand the shortage of mental health care professionals, whether I'm at a jail, a school, the VA, anywhere in our community, there's a shortage. But why is the VA not one of their locations of choice for employment? We have both the Hampton VA and we have 2 military and treatment facility hospitals as well, one with Portsmouth Naval Hospital. We constantly losing providers between DOD, VA. It takes months to bring someone on board, even if they're identified. So just at the administrative level with the hiring process, can we not do something to make that more efficient, to make it a more attractive place to work, to be able to provide health care to these these veterans?
Before I turn it to you, Dr. Carroll, a couple things just to say. We have an initiative to hire right, hire fast. So we are really trying to do that, and we would target a particular area like Hampton because of the vacancy rate. We are also trying to use all the flexibilities that we have in terms of what are the kinds of incentives that we can offer people.
But for the hire fast, so I've been to the VA 4 times in the last year, and I hear that it takes them months. They have to re-credential someone. I mean, someone might already be working for a VA facility in another state. They might be working for DOD. They're already working as a healthcare provider in a federal healthcare system. Why do we have to go back to ground zero and verify every single credential when there should already be a standard record saying that this person, meets the standard to be employed by us? It's adding months and getting people into a treatment room where they can treat veterans who need the care. So can we do anything to streamline the process and just get rid of what seem like true redundancies?
We are taking a close look at the credentialing process and what are the things that we can do to improve that. But you're exactly right. It is challenging, and we do replicate that information. I think the issue is you never want anything to slip through the cracks. So we need to tighten up our process and make sure, just like everything else, we have 0 defects when we do this as well as anything else. Dr. Carroll, anything else?
So I would just highlight it. We have a mental health sustainability initiative going on currently, where we're looking at not just bringing on new providers as we want to do, and we've had success with that, but we're also looking at retaining our providers. And so we have had a national program to conduct stay interviews because we want to minimize our losses, and generally speaking, we do fairly well in that regard. We're also looking at things like open and continuous recruitment for these critical vacancies that you mentioned.
Well, I'll just bring something up about retention. And I have found that, providers like to work at the VA. They like to provide that care. But the environment for employees at the VA right now is very tense and very stressed, especially due to the fact that a lot of them feel like they have no recourse as far as some of the executive orders that have been passed, the fact that employees are being disciplined without the ability to repeal those specific actions, the fact that unions are basically that represent them and represent their rights are being kicked out of VA facilities, that time is not allowed for the people who represent them. And I hear this over and over again from longtime VA employees who want to continue to work there, but they really feel like their rights are being infringed on. And how do you address that with your workforce to make them feel like they can have fair representation and fair recourse in employment decisions?
You may answer the question. Go ahead.
Well, I think one of the things that is very important to all of us is that people have the opportunity to be able to respond to or raise any concerns that they have. I mean, that's why we established the Office of Accountability, so that there are places for people to go. There are hotlines, anything if they are worried about things that happen. I have to say that my preference is
When you say people, this is for employees.
staff, I'm sorry, yes, for staff. I apologize for using that terminology. For any of our employees to go. I mean, I am hopeful that our leadership is listening, and that one of the ways that we can learn to better ourselves is by listening to our employees and reacting to what they tell us to make the environment a better place. That's the expectation that I would have of anyone who works in our environment.
And within mental health, we conduct an annual mental health staff survey every year, and that is part of our metric in terms of how we look at the experience of care. It's not just from the veteran's perspective. That, of course, is the most important thing, but we need to find out from our providers, and we do, whether or not they can schedule appointments as frequently as they feel that they should, whether they feel supported by leadership. So we ask that annually, and we use that in our oversight process.
All right.
I appreciate the feedback on that. I'll just tell you from what I hear from employees at the VA in our region is they don't necessarily feel that they have that outlet. And we have new leadership. I'm very encouraged by our new director, and I know that he's working very hard to improve that morale. But just as one VA around the country, I just wanted to make you aware that there's a significant amount of concern amongst the
Ms.
VA
Luria,
employees.
Ms. Luria, we have to move on, but thank you. I associate myself with your frustration.